Hi, my name is Arizu Salamat and I would like to share with you my Capston project. The title is Collaboration with Child and Family Services to Sustain Foster Care Placement for Young Children. The purpose of this project is to support and sustain foster care placement of at-risk children from birth to 3 by providing resources and training programs for social workers at Children and Family Services in San Bernardino County. At-risk children are identified as children who were exposed to drug and alcohol during pregnancy or experienced maltreatment. The children from birth to 3, their needs and the intensity of their care at times could be complex that a caregiver might not be able to provide appropriate care for these children. So often these children experience trauma, neglect, and maltreatment. In fact, according to the Department of Health and Human Services, they estimated that 1,740 children who died from abuse and neglect in 2008, more than 3/4 were 3 years old or younger. Maltreatment is becoming public health issues. According to the Centers for Disease Control and Prevention, maltreatment impacts the nervous and immune system, which leaving children vulnerable to chronic diseases later in their life. Impact of the trauma at times it also interferes with the development of the brain. Dr. Melmet, Executive Director of 03, indicated that maltreatment chemically alters that development and can lead to permanent damage of the brain's architect. This group of children often have difficulty with processing sensory input. This group of children are at risk of living in a dysregulated state of arousal, and in fact they have difficulties with calm and organizing their nervous system based on the demand of the environment or the task. Bonding and attachment is another issue that this group of children also often faced with. Dr. Perry and colleague indicated that reactive attachment disorder is a frequent diagnosis given to children who experience severe early neglect and trauma. Children that experience RAD often have difficulty relating to others, bond, and forming meaningful relationships. Why occupational therapy? And thinking about the previous slides and knowing that these children may have difficulties with bonding and attachment and possibly difficulties with sensory processing, or maybe even difficulty with, or maybe they have some issues with overall development, it may impact their participation and also engagement and interaction with meaningful occupations. According to Case Smith, occupational therapists develop intervention based on analysis of the child's behaviors and performance, the occupations in which he or she engages, and context of those occupations. Occupational therapy practitioners also collaborate and also consult with caregivers and also other family members to best support the child's active participation in meaningful activities. Looking at Children and Family Services in California, CFS is a division of California Department of Social Services. Ms. Avi Motitek, she is the director of CFS in County of San Bernardino. She stated the mission of this program is to protect children, offer services to stabilize families to remain together, provide permanency for children if they cannot remain safely in their own home, and finally strive to make the lives of children and families better. CFS also provide diagnostic assessments and also develop a treatment plan, as well as securing safe and permanent home, and at times they also provide case management. Now, looking at the theories and also the model that will support to develop my Capstone project, the model that I'm going to be utilizing is occupational justice. Occupational justice emphasizes in participation of an individual. It is through participation in meaningful occupation that an individual grows and also learn to adapt and respond to the demand of the task, and also engage and interact within the context of his or her own physical and emotional or social environment. The theories that is going to be utilizing, one of them is child development and also area sensory integration. The objectives of this program is thinking about two different activities is going to take place with Capston project. The first one is research, and the second one is program development. The research, I'm going to be looking at collaborating with occupational therapy practitioners, and whether occupational therapy practitioners and social workers can work together to sustain foster care placement. The program development is looking at designing a research manual that incorporates sensory strategies and developmentally appropriate childhood occupations to promote engagement and meaningful interactions. Research will be initiating with meeting with CFS managers, program director, and also administrative to identifying a site. And after that, I'm going to have social workers complete a survey. Based on that survey and analyzing the data, I'm going to be designing up to 3 workshops that will take about 2 hours. And also I will be conducting a post-survey. The program development will initiate with identifying list of available resources that social workers have that will provide for foster families, and also based on that I'm going to be creating a research manual that it encompasses sensory strategies and also appropriate childhood occupations that will emphasize for the age group from birth all the way to 3 years old. The outcome of the Capstone project is to support and sustain foster care placement by providing resources and educational workshops for social workers. The program effectiveness will be conducted by having semi-interviews with social workers and program managers and also program director. And also I'm going to be utilizing another survey to analyze and see the effectiveness of the program. Looking at this project with the alignment of the university and also OTD program, one of the missions of the Loma Linda University is expanding and applying knowledge, as well as providing comprehensive, competent, and compassionate healthcare for the whole person. This program, it's going to be looking at looking at a child within the context of his or her own environment, and then supporting adults and also responsible parties to support these children to engage and also interact with others and enjoy childhood, and also develop and become productive member of their family. And looking at OTD mission, this program play a very important role in advocacy, not only for the profession but also for the client as well as community, and looking at supporting these children within this small community of San Bernardino, how this support may impact and may support the growth of the community as whole, and becoming and being able to participate in meaningful occupation in order to support the community. Thank you so much for your time, and I'm looking forward to have a discussion and answering any questions you have.